some of you don't know the next person who's going to speak, but you will do very shortly, because she's fantastic. It's Janet Smith, and Janet is the head of sustainability at the Royal Wolverhampton and Walsall Healthcare NHS Trust. So yes, she has the privilege of working for David Loughton, but she's really going to talk to us about green sustainability. And it's a really important topic for today, as we're all getting mesmerized by the clinical priorities in health and social care. It's easy to let the carbon reduction and sustainability agenda kind of slide down the priority list. Janet is determined to keep us up there right at the very top. And obviously we've got leaders who are in Egypt at Sharm el-Sheikh at the moment discussing what the heck is going to happen. Janet is the living embodiment of what can happen if you take things seriously. Janet, I'm going to hand straight on to you. Thank you very much.
Thank you so much, John, and thank you so much for the privilege of actually presenting in today's conference. What I'm gonna do today is actually share with you guys what we're doing in terms of implementing our sustainability agenda, and at the same time also talk about what are the challenges that we have actually encountered in implementing those and what we have achieved. RWT has a green plan which runs in 2020-2025. It was meant to be 2020-2025, but COVID and things happened, so we started implementing our schemes July 2021. So the green plan focuses basically on effective leadership and governance, waste, reduction of waste, decarbonizing our building and estates, and reducing our energy and water consumptions, sustainable care models, procurement, etc. The target is 25% reduction in 2025 and net zero by 2040 on the direct emissions, and net zero by 2045 for the NHS Carbon Footprint Plus. If you ask me why 25% reduction in 25, there was no science about it. It's just that we thought it sounds nice, 25 to 25. So that's that. We also have recently, the Trust Board has recently signed off the Trust Adaptation Plan. And I think we're one of the first in the NHS who actually has an adaptation plan. The plan actually assesses the impact of climate change, its impact to our services and infrastructure, and also it sets out mitigation and adaptation actions for current and future impact of climate change. What contributes to our carbon footprint for RWT? So if you look at the figures on the other side of the screen, on your left, I think on my right, it's the four top ones is trust supply chain. So all the things that we procure contributes 21,234 tons of CO2, and that's just for RWT. The next one is gas consumption, and that's mainly due to our CHP. And then the third one is capital spend. People would think that surely energy should be in there, electrical consumption should be in there, but surprisingly, capital spend is the third. Then the fourth one is pharmaceuticals. So that's pharmaceuticals, and then trust medical equipments, and then you then have new cross electricity contributing to that. So where are we now in terms of implementing our initiatives? From July last year, 5th of July last year until June this year, we've managed to reduce 5,535 tons of CO2, which is actually 9% of our total carbon footprint, which is just over 63,000 tons. So that's our baseline figures is 2020 to 21, not 21-22. So that's a correction I need to do. But yes, we managed to reduce 9% of our carbon footprints. And this doesn't include our widely publicized solar farm, because it hasn't generated its energy yet. It's scheduled to generate in March. And we, of course, have anticipated carbon reductions as well from the PSDS decarbonization scheme monies that we have. So the 9% is actually all what we call low hanging fruits, which didn't cost the trust much to implement. The figure that you see is just a few of the things that we have implemented. And funnily enough, majority of them are on scope 3, which is basically the most difficult scope to reduce or to tackle. So what do we do to actually ensure that we know where that 9% came from? We actually have carbon reduction and monitoring tools. We have a carbon reduction crib sheet, which is basically as it is. It just tells you the things to consider when you're looking at your service and reducing each of there. So like admin, the building, energy use, waste, etc. The carbon reduction crib sheet has things in there that basically like just to nudge you in looking at specific things within your department, within your service, or within the staff group to encourage individual and the team to actually start reducing your carbon footprint, either on a personal level or a team level. We also have sustainability impact assessment tool, which has been signed off by the trust board to be used to assess the sustainability impact of our business development, investment, and procurement decisions, which means includes business cases. Next one is we have the sustainability initiatives tracker. So the sustainability initiatives tracker track every single things that each of the greening services club, I call it greening services club, is doing. So one initiative in there, one group has actually put in reduction in the use of Post-it, because they use 20 of those tubs of Post-it a month. So they reduce it. That means then there is cost improvement and at the same time reduction in carbon in terms of less use of paper. So those are the kind of things that the sustainability initiatives tracker track, because we realize that we need to start actually quantifying the things that we're doing to reduce carbon. So that's what the tracker does. So we also have the carbon footprint tracking dashboard, where all our initiatives and also our baseline is actually located, and we then see how we are affecting the initiatives are affecting each of those items in the carbon footprinting tool result. So this is just the sustainability impact assessment tool. So just a sample, you can see that it looks at energy, water, waste, capital projects, procurement, adaptation, and social value is part of it as well, including travel. So that's the sustainability initiatives tracker. I thought I'll just give you an idea how it looks like. It's a very simple thing, and each of the department uses it, and they put everything that they can think of in it, and then we then look at its outcomes, both on service efficiency, benefits that it's delivered, cost improvement, and then carbon reduction. What are the strengths that we have? Because sometimes they said, wow, 9% is quite a lot to actually achieve within a year. One is that we have a board approved green plan. And we also have existing leadership and governance structure that monitors the implementation and facilitate and monitors the implementation of the green plan. We have the full support of the trust execs. We also have a core group of trust officers with experience in implementing a successful carbon management plan, because the trust was part of the pilot trust back in 2010, who actually implemented the CMP, and we managed to reduce 14% of our carbon footprint by then. And the experience from that has been carried because some of the people that were key actually in the implementation of that is still in the trust, and I was one of them. The next one is we have actually staff who are passionate about climate change, and they come up with suggestions that you wouldn't think, and sometimes because business as usual, when we see things every day, sometimes we don't actually notice it anymore because it's part of the daily life, the daily grind, or the daily activities that you do. But then with someone with a fresh eye would say, actually, why do we do that? Then it gives them an idea, that seed of idea that, oh yeah, we can actually do something about it. And then the other thing is we have a clinical sustainability lead, which is really, really important because I could be speaking to a group of clinicians and telling them about the need to reduce the use of specific anesthetic gases. But because I'm not a clinician, I'm not an anesthetist, I could talk to them until I'm blue in the face in terms of there's no clinical reason why we should use this fluoride. But then they would just say, you're not a clinician. We don't know. So that clinical sustainability lead is the person that looks at the delivery of the green initiatives actually in clinical services areas. We're like a tandem. So what are the challenges that we've been experiencing and continue to experience? I think for some that has heard me talk before, you'd say, oh, that's exactly the same challenges. But it is, because it's still ongoing and will be ongoing in the next few years. One is actually gaining the support of the staff. There's still a lot of staff that, of course, they do believe in it, but it's about convincing them to take action is the challenge. Becoming a climate smart healthcare provider, so embedding the low carbon approach in the trust processes and services, that will continue on. Particularly that, of course, we now work across WHT and RWT, and that's important that we are singing from the same hymn sheet, as they say. And then funding and resources, there's always a cost improvement program. I don't think there's an NHS trust that doesn't have a cost improvement program. And it's about then looking at which one, the balancing act that needs to happen when it comes to, do we actually look at prioritize cost improvement, or do we prioritize investing in green activities or green schemes that will actually improve the trust processes that will eventually save money in the future. So it's about what needs to happen now and what's actually investing in the future. Next one is funding and resources. The need to align net zero ambitions with existing commitments and appropriately resource the implementation of the green plan. Because at the moment, with the cost of living crisis, with the increase on prices of heat pumps and etc. So when there's actually like schemes that are what we call green schemes, they tend to carry what we call sustainability or green premium as well. So they cost more than the usual technology. So it's really trying to get a balance of that without depriving the other areas that also needs funding. The last but not the least, actually, which is going to be the biggest challenge that we will have in the coming years, is the climate change impact. So implementing mitigation and adaptation of our estates and services is huge challenge coming up. As we all know, we've already experienced a lot of overheating over the summer, and we will be expecting a lot more windstorms and other storms, given that the planet is actually heating. So that's one of the areas, and the reality is that within RWT and WHT, our estates are not actually climate impact resilient. So the need to retrofit for our energy, heat pumps and things like that, and also the need to actually ensure that our estates would not be our patients would not be experiencing 38 degrees Celsius um, temperature when they're lying in their bed sick. So that's the issue there. Opportunities. There's always opportunities. There's always opportunities to strengthen partnership, like what we're doing, of course, with the institute, learning a lot, and at the same time collaborating with local partners like National Express, the FWM, local ICSs, and then regional networks, the national agencies, and also international organizations to learn and collaborate on specific things and specific initiatives, and even just to actually know, because sometimes when you're working with sustainability, it gets overwhelming and you feel like, I certainly, like, am I doing the right thing? You get overwhelmed, and it's good to actually then speak to someone that is like, actually, you're not alone in it. There are other people who are experiencing the same challenges, and it's heartening. And then, of course, we got access to external green funding, given the age of the trust, as David said earlier. The NHS funding is actually quite challenging at the moment. So we do have access to certain funding like SBRI, the recycling fund, the SALIX decarbonization scheme. So, and there's always something, little things that locally offered as well. That it's just about keeping your eyes peeled. And that's it. That's the end of my presentation. Any questions?
Fabulous job, Janet. I told you she was good, didn't I, everybody? I told you she was good. That's fantastic. I mean, the breadth of stuff that you're involved in, and I love the attention to now gathering evidence about the effects that you're having, you know, at a real micro level. I think that's really fantastic. So look, there you are. You've heard it. You've heard it. What do you make of that? Would anybody like to ask Janet a question at all? Do please, you know, raise your virtual hand, and we'll go from there. Can I? Well, whilst we just wait for that, let me just step in with one quick question, if I may. For anybody watching this who isn't in a, you know, head of sustainability role, but actually is just interested in contributing to sustainability in their trust, and maybe they have the misfortune to work in a trust that isn't as switched on to carbon reduction and sustainability as Royal Wolverhampton and Walsall Healthcare, how do they go about collecting evidence around what is the current impact of the team or department that I'm leading in respect of current CO2 emissions, for example? Any thoughts on that?
There's actually a lot of case studies that's available online, and at the same time there are actually other, you know, within Greener NHS itself, there are ways and means to find out. But most importantly is that one of our greening services team or greening services departments, actually what they've done is that during COVID they thought of a way that because of course the hospital outpatient services was closed, no one was allowed in, and they said, we don't want to actually miss giving, you know, giving the service to our patients, and we don't want, because of course in one eye as well, I think what it was is that they also realized it would be dreadful, you know, amount of people who will be on the waiting list, waiting for them to see them when the service opens. So what they did was to actually look at, can we bring them in through video, you know, conduct that.
There's virtual consultation stuff. I think what the question was aiming at, where would somebody who's in the audience today and is keen to get more involved in measuring environmental impact from their team, where would they start? And you're suggesting there's plenty of stuff with the NHS Sustainability Unit and elsewhere. If you go there and have a look, you'll find quite a lot of information there. Is that fair, Janet?
That's fair. And at the same time, one of the things that actually quite key is that when you start talking to your colleagues, you'll find that your colleagues as well has interest on climate change. And it's just about having that conversation and then starting then as a group, a small group, and saying, what can we do to actually contribute? And then that then starts. And it's those little groups, 1 or 2 people talking to each other, and then start talking to the rest of the team. That's where then the ideas comes in, because that's how our greening services teams actually starts. It wasn't me going to them, but it's actually them coming to me and said, oh, we've thought about this. Would this actually work? And then
you're providing a forum really to collect up all of these great ideas, which rather David's put a question in saying it's a huge topic, sustainability. How do you make it achievable on a local level? I guess that's it, David. You start small, you just encourage people to have micro level conversations about, relatively speaking, micro level things that they are doing. And then you create an environment in which those can be collected by people like Janet. And from there, emerges a sustainability service within your trust, basically. That's terrific. Okay. Got one more question, which was from Kevin. So how does your sub-executive team balance this sustainability agenda with their high activity operational day job? It's a question that we've referred to with David earlier as well.
Yeah, I think
how do we keep greener care, sustainability at the top of the agenda rather than letting it slide down with everything else that's going on?
Yeah, the trust has a sustainability group, which actually looks after the day-to-day implementation of the sustainability agenda. That sustainability group is actually composed of people who are what I would say responsible department specific. So you have estates and facilities, which is responsible for energy, wastewater, etc. Then you have estates development, which is responsible for the capital spend and the capital carbon. You've got procurement. So this sustainability group is actually composed of all those people who are what I would say responsible for specific focus area within the sustainability plan or within the green plan. And they are the ones who's responsible to implement it. My role within that group is actually facilitator. I facilitate the process. And then we actually report to the performance and finance. I report to them every 2 months. Used to be every month, but I said, give me every 2 months because every month there won't be much to report. And then the same report then goes to the TMC, the Trust Management Committee, on the twice bi-monthly as well, and then the Trust Board. So which means then that the whole of the achievements and the issues that the sustainability group actually raise go straight right up to the Trust Board, and I do get invited to present some of the bigger issues specifically, and I always say that these are what we've achieved. These are the issues. There are the activities in the next 6 months, and these are the areas I need capital funding.
I'm sure David's very grateful for that.
So
the point is that you've embedded this structure
yeah.
into the organization, and it's there, and that's not going anywhere irrespective of other priorities. That structure is embedded, and has the support of the board as well, which is important.
Yes. And I think what's important, the key thing I would like to say actually is that sustainability has to become part of the business as usual. because that's the only way that it will actually be sustained as well. So any benefits or any changes that the schemes that you implement or the changes in the processes that you implement has to become business as usual, because that's the only way that those benefits and changes will continue to actually deliver what it was meant to deliver. Because if it is always treated as an just an agenda, something that when the NHS takes their eye off it, then it just drops down the priorities. That's not what sustainability is all about. Sustainability is about making sure that whatever changes, whatever benefits and things that we're doing is actually sustained by making it business as usual.
There you go. Perfectly put. Well, I hope that's been of interest. Just to put note, if you're not looking at the chat, some of you, Jade has put in there notice about our next Greener Care Special Interest Group meeting, and Janet's often an enthusiastic supporter of that. Janet, may we, on behalf of everybody, just say a huge thank you to you for coming along today and sharing that fabulous presentation. I really enjoyed listening to that and watching some of your slides. Great stuff.
Thank you so
very
much
much indeed.
privilege.
Thank you very much, Janet. Lovely.